Hello everyone and welcome back to our channel. Today, we're doing something a little different. So today, we'll be covering depression. We'll be explaining the symptoms, causes, and most importantly, we'll have tons of resources for you if you or someone you know needs help. This video will be updated with new research periodically. Please remember that this video is meant to inform and is not intended to be a substitute for professional advice. If you need help, please contact a professional. Let's get right into it. Okay, so first things first, let's begin with some definitions. But instead of getting too deep too fast, let's break it down into sections. First, we'll talk about depression, and then we'll discuss major depressive disorder. 1. Depression. Depression is a term used to describe a range of negative emotional states. Depression can be a reaction to loss or disappointment, or can be a symptom of an underlying mental health condition. In short, depression is a state and can be temporary, whereas our next term is an official diagnosis. Major depressive disorder is a mental health disorder characterized by a combination of symptoms that negatively affect your ability to function and carry out day-to-day tasks. According to the Diagnostic and Statistical Manual of Mental Disorders DSM-5, major depressive disorder is diagnosed when 5 or more of the following symptoms have been present during the same 2-week period, and at least one of the symptoms is either 1, depressed mood, or 2, loss of interest or pleasure. Let's take a look at the other symptoms. Depressed mood most days, which may involve feelings of tiredness, hopelessness, exhaustion, fatigue, difficulty concentrating, feelings of worthlessness or excessive or inappropriate guilt, and suicidal thoughts or behaviors. These are all common signs of depression. It's important to note that a diagnosis of depression is made by a qualified healthcare provider. Many of these symptoms could be caused by another condition or by certain medications. Next, let's cover risk factors. Risk factors are characteristics or conditions that make it more likely that someone will develop a mental health disorder. Having a risk factor does not mean that someone will develop a mental health disorder. Here are some risk factors for depression. Having a personal or family history of depression, experiencing trauma or abuse, having a chronic illness, experiencing a major life change, grief or loss, and lastly, social isolation. Of course, there are many more risk factors. This is just a short list to show you where to start. Now let's discuss how depression happens. Depression has both biological and environmental causes. Biological factors include having a family history of depression or bipolar disorder, which indicates a possible genetic link. It can also be due to altered levels of neurotransmitters in the brain, such as serotonin and norepinephrine, which affect mood, sleep, and concentration. Environmental factors include difficult life experiences such as grief, trauma, stress, or abuse. It's important to understand that no single event or type of event causes depression. Instead, it's a culmination of various experiences that overwhelm a person's coping mechanisms and ability to manage. Depression is not anyone's fault. There is no one cause, and it's certainly not a sign of weakness. Next, let's talk about the impact of depression. Depression has a profound impact on a person's overall well-being, affecting their relationships, work, school, financial stability, and physical health. For example, depression is associated with increased risks of other health problems such as cardiovascular disease, diabetes, obesity, and Alzheimer's disease. Depression can lead to feelings of isolation, withdrawal, and loneliness, further contributing to its negative effects. Depression is also highly correlated with anxiety disorders and substance use disorders. Now let's talk about treatment. Therapy and counseling are effective ways to manage depression. Depending on the type and severity of depression, medication might also be recommended. Some common types of antidepressants include selective serotonin reuptake inhibitors. SSR is serotonin and norepinephrine reuptake inhibitors. SNR is and serotonin modulators and stimulators, SMSS. Lifestyle changes like regular exercise, a balanced diet, and adequate sleep can also play a role in managing depression. In addition to treatment, engaging in activities that bring joy and relaxation can help alleviate symptoms. However, it's crucial to remember that these tips are not a replacement for professional help. When to seek help. Depression can be effectively treated with professional help. However, it's essential to know when to seek help. If symptoms persist for more than 2 weeks, it's crucial to consult a healthcare provider. Additionally, if symptoms include thoughts of suicide or self-harm, immediate professional help should be sought. Reaching out for help is a sign of strength and the first step towards recovery. And now we're going to talk about something very close to our hearts. Because we love all of you guys watching this channel, we'll talk about how to support yourself or someone else. Supporting yourself or someone with depression involves understanding, patience, and encouragement. For yourself, practice self-care, set boundaries, educate yourself, challenge negative thoughts, and seek support groups or therapy. For others, listen empathetically, offer practical help, encourage professional help, and be patient. Remember, recovery takes time. Now let's wrap it up with some frequently asked questions. Is depression a sign of weakness? No, depression is not a sign of weakness. It is a mental health condition that affects people from all walks of life. Can depression go away on its own? While some people may experience remission without treatment, it's generally recommended to seek professional help for an accurate diagnosis and personalized treatment plan. How long does depression last? The duration of depression varies, and it can persist for weeks, months, or even years if left untreated. With proper treatment and support, many individuals recover and experience significant improvement in their symptoms. Is there hope for recovery from depression? Yes, there is hope for recovery from depression. With the right treatment, support, and self-care, many individuals with depression can make a full recovery and live fulfilling lives. How can I help someone with depression? To help someone with depression, listen non-judgmentally, offer practical support, encourage them to seek professional help, and be patient and understanding throughout their recovery journey. Before we get into the resources, let's talk about how to back up your content with research papers. Including credible research papers in your video adds authority and educational value. Here's how you can do it. 1. Identify relevant studies using keywords like depression and treatment on PubMed Central, Google Scholar, or ResearchGate. Prioritize recent and peer-reviewed papers. 2. Focus on key papers to avoid overwhelming your audience. Select studies that provide a broad overview of depression or specific aspects you're discussing, such as symptoms or treatments. 3. Integrate quotes or summaries from the papers. You can include direct quotes, paraphrase key findings, or summarize the main arguments. Cite the source appropriately by providing the publication details. Research papers that we found useful. Depression by StatPearls, Major Depressive Disorder by StatPearls, Depressive Disorder by the World Health Organization, Diagnosis and Management of Depression in Adolescents by Canadian Medical Association Journal, Serotonin in the Theory of Depression by Nature Reviews Neuroscience. We'll leave links to these papers in the description below. Pro tip: check out Trip Database for a great place to find research articles for your next video. Let's move on to some additional resources that we found helpful. American Psychological Association, Beyond Blue, Center for Addiction and Mental Health, Depression and Bipolar Support Alliance, Institute of Mental Health, National Alliance on Mental Illness, National Institute of Mental Health, Resolve to Save Lives, Suicide Awareness Voices of Education, World Health Organization. Once again, we'll leave links to these resources in the description. And finally, let's end this video on a positive note. Recovery from depression is possible, and many individuals who experience depression can and do make a full recovery. By educating ourselves about depression, seeking help when needed and supporting others, we can create a world that is more understanding and compassionate toward those who face this challenging condition. Thank you so much for watching and being a part of this journey with us. If you found this video informative, please hit the like button and subscribe for more valuable content. And if you want to support us even further, consider becoming a patron. Your support allows us to continue creating high-quality educational videos that make a difference.